The surgeon was still laughing when the human opened his eyes. Not the polite, suppressed amusement that medical professionals deployed when something struck them as funny, but protocol required restraint. The full, open laughter of someone who had forgotten, in the moment of it, that the subject of the amusement was present. Dr. Veth Koran had been a trauma surgeon at Vethara Station's medical complex for 19 years and had operated on beings from 47 different species, and had never, in 19 years of that, encountered anything quite like the file that had come through with this patient. The file was the funny part. Not the patient himself, who was unconscious and therefore not participating in the joke. The intake form. The medical history section of the intake form, which every patient completed on arrival, and which the translation system rendered into standard conclave medical language, had produced, in the section labeled prior injuries and medical events, a list that Koran had read twice before calling his resident in specifically to read it as well. The resident had also laughed. The list was long. It was long in the way that things were long when the person compiling them had a comprehensive memory and a thorough commitment to accuracy, and had apparently spent a significant portion of their existence in situations that generated entries for a list of this type. Broken bones, 14 of them across various limbs, all healed without medical intervention. Lacerations requiring closure, the list specified the number, and the locations with the precision of someone accustomed to cataloging these things. Burns classified by degree, both thermal and chemical. One entry that the translation system had rendered as fell from significant height, survived, and had added in the notes field happened twice. The entry that had made Koran call the resident was near the bottom. It said removed on appendix, field conditions, no anesthesia. The resident had read that one 3 times. The patient's name was Corporal James Osai. He was human, 29 years old. He had come in through the emergency bay at 3:40 with a deep laceration across his left side from what the attending intake nurse had logged as a workplace accident involving heavy equipment, which was a description so inadequate for what the wound actually looked like that Koran had mentally revised it to something significantly more dramatic the moment he saw the scans. The surgery was routine by Koran standards. Not simple, the laceration had depth and the repair required care, but routine in the sense that he had done this category of repair many times, and the variables were known, and the outcome was not in question. The human's biology was well documented in the conclave's medical database, and the anesthetic protocol was standard for the species. The anesthetic protocol was standard for the species based on the conclave's medical database. The conclave's medical database had been assembled across 42 years of Earth's membership from the medical data that Earth had provided during the membership process, and that had been supplemented by the clinical experience of the conclave's medical facilities treating human patients in the years since. The database had not been assembled from patients like Corporal James Osa. This was the thing that nobody in the operating theater understood yet. Koran was still laughing at the intake form when his anesthesiologist, a careful Velthun named Prieth, who had been managing anesthetic protocols for 30 years, and who did not laugh at intake forms because intake forms were professional documents, and laughing at professional documents was not something she did, said from her position at the monitoring station, "Doctor, the patient's metabolic indicators are shifting." Koran said, "Within normal parameters." Prieth said, "They were within normal parameters 4 minutes ago. They are currently at the edge of normal parameters and moving." Koran said, "Adjust the dosage." Prieth said, "I have adjusted the dosage. The indicators are continuing to shift." Koran looked up from the repair. He was midway through. Prieth said, "Doctor, the patient's metabolic rate is significantly higher than the database baseline. I am seeing enzyme activity levels that are not consistent with standard human physiology." Koran said, "The database baseline is accurate for the species." Priyeth said, "The database baseline may be accurate for the species in aggregate. I am not sure it is accurate for this specific patient." Koran said, "Adjust again." Priyeth adjusted again. The monitoring system produced an alert. Priyeth looked at the alert. She said, "Doctor." Something in the way she said it made the laughter stop. Koran looked at his monitoring feed. The patient's metabolic indicators were not at the edge of normal parameters anymore. They were significantly outside them, moving in a direction that the monitoring system was flagging with the specific alert color that meant the anesthetic protocol was losing effectiveness, which was a color that Koran had seen in his 19 years of surgical practice exactly 4 times, always in emergency situations involving species with unusual metabolic profiles, where the database information was incomplete. He said, "Increase the dosage to the maximum safe limit." Priyeth said, "I am at the maximum safe limit for human patients." Koran said, "Increase it." Priyeth said, "Doctor, increasing beyond the maximum safe limit for human patients risks." The patient's right hand moved. Not the involuntary movement of a body responding to surgical stimulus, the small reflexive twitches that anesthetized patients sometimes produced. A deliberate movement. The hand moved from its position at the patient's side to the edge of the surgical table, and the fingers found the table's edge and gripped it. The operating theater went very quiet. Koran looked at the hand gripping the table. He looked at the monitoring feed, showing the metabolic indicators. He looked at the anesthetic administration display, showing Priyeth at maximum safe limit. He said in a voice that had lost the laughter entirely, "Increase the dosage." Priyeth said, "Above the safe limit." Koran said, "Yes." She increased it. The monitoring feed showed the additional dosage entering the system. The hand continued gripping the table. The patient's head turned. Not all the way. The movement was small, the movement of someone fighting through a significant chemical load with the specific determination that fighting through significant chemical loads required. The head turned and the eyes, which should have been closed and should have been staying closed under a dosage that was now above the maximum safe limit for a human patient, opened. Not fully, partially. The specific partial opening of someone who was not fully conscious, but was not fully unconscious either, and who was operating in the space between those two states, with a quality that Koran could not immediately categorize. The eyes found him. Koran was a trauma surgeon. He had been in difficult situations. He had operated in crisis conditions and had kept his composure in operating theaters where composure was the thing that determined outcomes, and had developed, across 19 years, the specific professional steadiness that the job required. He met the patient's eyes. The patient said something. Not loudly. Not with the panicked urgency that patients who became aware mid-procedure typically produced, the sounds of someone who was frightened and in pain and disoriented and expressing all 3 things simultaneously. Quietly, with a quality that Koran's translation implant rendered as completely calm. The patient said, "How much longer?" Koran stared at him. The patient said, "The repair, how much longer do you need?" Koran said, because his 19 years of surgical practice had produced, among other things, the ability to answer questions in operating theaters under unusual conditions, approximately 12 minutes. The patient said, "Okay." He said, "I can feel that, by the way." Koran said, "I know, I apologize, we are at the maximum safe dosage." The patient said, "It is fine, I have had worse." He looked at the intake form on the display above the surgical table, which was standard practice for patients to be able to review during procedures if they were conscious. He said, "You read the form?" Koran said, "Yes." The patient said, "The appendix entry." Koran said, "Yes." The patient said, "Field conditions, no other option." He said it the way people said things that were simply facts about what had happened, without the weight of drama that the facts might seem to require. Koran said, "The prior injuries list." The patient said, "Yeah." Koran said, 14 fractures. The patient said, "Give or take." Koran said, "All healed without medical intervention." The patient said, "I was not always near a medical facility." Koran said, "The falls." The patient said, "The first one was an accident, the second one I was pushed." Koran said, "From significant height." The patient said, "Significant is relative." He said, "Are you almost done with that section? It is pulling." Koran looked at his work. He was not almost done with that section. He worked faster, not sloppily. 19 years of surgical practice did not produce sloppiness under pressure, but faster, with the specific efficiency of someone who has a new piece of information that has rearranged their understanding of the timeline. His resident, who had been in the corner of the theater processing what was happening with the expression of someone whose medical training had not included a module on this, said very quietly, "Doctor, the patient is awake." Koran said, "I am aware." The resident said, "He is awake and he is having a conversation with you." Koran said, "I'm aware of that as well." The resident said, "While you are operating on him." Koran said, "Yes." The resident said, "And he is calm." Koran said, "Apparently." The patient said, "Is that your resident?" Koran said, "Yes." The patient said, "First time seeing this." The resident said from the corner, "Yes." The patient said, "It is fine. I will not remember most of it anyway. The anesthetic is still doing something." He said, "It is doing less than you intended, but it is doing something." Priyeth said, from her station, "The dosage we have administered would render a standard human patient unconscious for approximately 6 hours. The patient said, "I have been told my tolerances are unusual." Priyeth said, "That is one word for it." The patient said, "The medical database." Priyeth said, "Is apparently not calibrated for your specific profile." "No." The patient said, "You should update it." Priyeth said, "Yes, I intend to." She said, "May I ask some questions for the update, while you are available?" The patient said, "Sure." She said, "The metabolic rate, is it consistently elevated or situationally elevated?" The patient said, "Situationally. It goes higher under stress or physical demand. Right now it is at whatever level my body decided surgery counts as." She said, "And your body decided surgery counts as?" He said, "Apparently a moderate stress event, not high, moderate." She said, "Moderate." He said, "I have a higher end." She said, "Yes, I imagine you do." She said, "The enzyme activity levels. The specific profile I am reading is not in the human database at all, not as an outlier, not at any level, it simply is not there." He said, "It is a thing that happens to some people who have been in certain environments for long enough. The body adapts." She said, "What environments?" He said, "The kind that generate a list like the intake form." She said, "The kind that generates 14 fractures and 2 falls from significant height and a field appendectomy." He said, "And the rest of it, yes." She said, "The rest of the list." He said, "The list is not complete. I left some things out because the form had a character limit, and I prioritized the entries that seemed most relevant to today." Priyeth looked at the form. She said, "You left things out." He said, "Some of the older stuff." She looked at the form for a moment. She said, "The form is quite long already." He said, "I know." She said, "And you left things out." He said, "The character limit." Koran said, "I need you to hold still for approximately 4 more minutes." The patient said, "Sorry." He held still. Koran worked. The theater was quiet except for the sounds of the procedure and Priyeth's monitoring station, and the specific quality of a room in which everyone present was processing something, and doing it internally. The resident in the corner was doing the processing with the expression of someone whose entire medical school curriculum was being revised in real time. At minute 3 of the 4 minutes, the patient said, "The laughing earlier." Koran said, "I apologize." The patient said, "It is fine. I know what the form looks like to someone reading it for the first time." He said, "The appendix one gets people." Koran said, "Yes." The patient said, "It was not as dramatic as it sounds. The conditions were difficult, but the procedure itself is not complicated if you know what you are doing." Koran said, "And you knew what you were doing?" The patient said, "I had read about it and I had some help. Someone talked me through it." Koran said, "Someone talked you through removing your own appendix in field conditions." The patient said, "She was very calm about it, good instructions." He said, "She was a doctor." He said, "Sort of." Koran decided not to ask what sort of meant. He finished the repair. He said, "Done." The patient said, "Thank you." He said it with the specific sincerity of someone who had been through something, and was genuinely grateful for the person who had handled it. Koran looked at him. He said, "You are welcome." He said, "Corporal Osai, the anesthetic we administered will provide some continued effect over the next few hours. You should rest." The patient said, "I know I will." He said, "The form, the complete version, if you would be willing to provide it for the database update." The patient said, "Sure." He said, "It will be longer." Koran said, "I expect so." The patient said, "You might want to sit down when you read it." Koran said, "I have been a trauma surgeon for 19 years. The patient said, "Yes." He said, "Sit down anyway." Koran looked at him for a moment. He said, "I will take that under advisement." The patient closed his eyes. Within 4 minutes, the additional anesthetic had done enough that his breathing slowed and the grip on the table edge released, and the specific quality of consciousness that had been present in the operating theater for the last 20 minutes receded. The theater was quiet. The resident came out of the corner. She said, "Doctor." Koran said, "Yes." She said, "I have a question." Koran said, "Yes." She said, "The intake form." Koran said, "Yes." She said, "You were laughing at it." Koran said, "Yes." She said, "Are you still laughing at it?" Koran looked at the form on the display. At the list of 14 fractures, and the falls and the burns and the field appendectomy, and the entries that had not made the character limit. He thought about the metabolic indicators and the anesthetic at above maximum safe dosage, and the hand gripping the table and the eyes opening, and the voice asking how much longer with the specific calm of someone for whom surgery was a moderate stress event. He thought about what it meant that this was a moderate stress event. He thought about what the higher end looked like. He said, "No." He said, "I am not laughing at it anymore." He said, "Update the database, full profile, everything he is willing to provide." He said, "And flag it for the medical division's research team." She said, "Why the research team?" He said, "Because what we just observed does not match any baseline in the human medical database, and the database is used by every medical facility in the conclave that treats human patients, and every one of them should know that the database has a gap." She said, "What kind of gap?" He looked at the patient. At Corporal James Osai, 29 years old, currently sleeping off an above maximum anesthetic dose with the peaceful expression of someone for whom this was, apparently, a routine Tuesday. He said, "The kind that happens when you build a database from average data, and the civilization it describes produces people who are not average." He said, "The database describes humans." He said, "What we treated tonight is something the database does not fully have a category for yet." He said, "That is the gap." He said, "Flag it." She flagged it. Koran walked out of the operating theater into the corridor and stood for a moment. He thought about the intake form and the laughter and the 19 years of surgery and the 4 times he had seen the alert color that meant the anesthetic protocol was losing effectiveness. He thought about how much longer and okay, and I can feel that, by the way, and I have had worse. He thought about what kind of existence generated a list like that form, and then generated a person who discussed it calmly while awake on a surgical table. He thought about the things that had not made the character limit. He went back to his office. He sat down. He read the full form again. Then he opened the database update file and started typing. He typed for a long time. He did not laugh once.